Hey there, everyone. I'm Brad Smith, and I am joined today with Dr. Wendy Gallego in Miami, Florida. How are you today, Dr. Wendy?
I'm great. How are you?
Hey, I'm doing great. Thank you so much for joining me today. If you could tell the audience a little bit about what you guys offer and the type of patients you work with.
Sure. We offer a variety of services here. We offer chiropractic and acupuncture, decompression therapy, which is for herniated discs. We offer telemedicine, nutrition, psychology, neurofeedback, homeopathy, Reiki, and massage, as well as corrective exercise programs.
And we spoke before the show, and I thought it was great, all the different services that you offer. Obviously, you can't do all of those services on your own. Tell me a little bit about the staff that you have.
Well, we have 15 different practitioners here. Myself, I'm a chiropractor. We have 2 chiropractors on staff. We have 2 acupuncturists. We have a psychologist, and she also does the neurofeedback. We have a medical doctor whose specialty is internal medicine, and he does the telemedicine. We have a Reiki practitioner. We have a homeopath. We have a nutritionist. And we have 3 personal trainers who do the corrective exercise program for us. And I think that I've gotten them all here. That's our staff, as well as, of course, all of the rest of the team that helps out to put everything together for everyone.
Wow, that sounds like a great staff, and it sounds like you offer a little bit or a lot of everything. There are a couple things in there that you mentioned that maybe people haven't heard of before. We know you offer the chiropractic and the massage and the training, but what are some of the things like the telemedicine and different services that you offer that someone might not recognize?
Yeah, there's a few of them. The 3 things that we offer that most people don't know about right off the bat are decompression therapy, which is for herniated discs. And basically what this is it's traction with technology. So when you have a herniated disc, what happens is some of the disc material has come from the inside of the disc and it's herniated out. And what happens when that occurs is the 2 vertebrae become closer together, and there's pressure that's put on the spinal nerves, and this is what causes pain. If we can figure out a way to separate the 2 vertebrae and allow that herniated material to come back inside, then we can take the pressure off of the spinal nerves and the patient feels better. We've known how to do this using traction for many, many years. The problem is traction doesn't work so well because once we get to enough release of pressure, the muscles start to go into contracture to protect you. So we kind of have an end point there. The technology comes along with this decompression therapy, and that it has a very sensitive sensor in the mechanism that's pulling or doing the traction. And if it feels anything pulling back against it, which it presumes is your muscles going into contracture, it tells the motor to go in reverse, and it reverses the motor until everything is lax again, meaning your muscles are relaxed, and then it does the pull again. So essentially, it takes the muscles out of the picture so that we can get enough of the traction or enough of the pull, or decompression specifically, to allow that herniated material to be brought back inside the disc and taken off of the spinal nerve. It does these corrections at a very high rate, so it does multiple corrections per second and just keeps the patient very, very comfortable, as in take a nap comfortable, and very effective for herniated discs, saving people from surgery. That's one of the things people don't know about.
Dr. Wendy, I didn't tell you this before the show, but I have herniated discs in my thoracic, lumbar, and even in my neck. Would that be something that would work for me in those 3 areas, or is it just for one area in the back?
It's for the cervical and the lumbar. To date, there's not a machine for the thoracic spine, and mostly that's because it's very difficult to herniate a disc in the thoracic spine. So usually it's a pretty big trauma that has occurred for that to happen. The thoracic spine is not weight-bearing. In general, most of the weight is taken by the cervical, which is the neck, and the lumbar, which is the low back. So we have a cervical and a lumbar machine, but so far there hasn't been a thoracic one that's invented.
Trust me, I know. I've tried everything.
Yeah.
All right, so tell me about the other 2 services you were mentioning, telemedicine and...
Telemedicine is very interesting. This is something very new. It is medicine via a portal. And this is being used a lot in hospitals right now. For instance, a doctor that needs to be at 3 different hospitals, it's very difficult with the traffic that's out there and whatever might come up on the, in life to prevent you from being in one place or the other, or really just needing to be in 3 places at the same time. So what they're doing is they're installing these portals, some of them very advanced, and they actually look just like a robot and move through the hospital hallways and hospital rooms on their own, and the head of the robot, so to speak, is a screen, and that's where the doctor is visible. But more than how cool that looks, it has a bunch of attachments so that doctor can actually do a full consultation and examination. So there are attachments, as a high-res camera, for instance, so the doctor can actually examine eyes, ears, nose, throat, and skin. There's an attachment for a stethoscope, and the doctor can listen to the heart and lungs in real time. There's many attachments, EKG attachments, so on. In my office, we're using it to help bring quality care to patients without having to wait in a doctor's office for 3 hours for that 5-minute appointment. It's just getting so hectic and so busy out there. So we know that you're here in my office for many services, and we want to be able to bring a well-rounded everything to you. So instead of having to wait at a different doctor's office for the 3 hours for that 5-minute service, we have Dr. Maggie Mann, and he is an internal medicine specialist over at Mount Sinai, which is just across the bridge from us. But he does his consultations via this telemedicine portal. And as I said, it's eyes, ears, nose, throat, skin, heart, lungs. If blood work needs to be ordered, that'll be ordered. If any diagnostic studies need to be ordered, any prescriptions need to be given. So basically everything that you need right here in our office.
That's incredible. I love that because, we're doing technology too. We're doing a video interview now. And, the power behind that, how many people they can help, how many more people you can help also is just awesome. So I'm glad you guys are in on the new technology. Now, you mentioned something about neurofeedback. Can you explain what that is also?
Yes. Neurofeedback it's a service that we offer it's all ages that we see. So sometimes we see kids with difficulty focusing, whether it be a diagnosed ADD or ADHD, all types of special needs. We see athletes looking for peak performance, and we see adults with sleeping problems or anxiety problems or difficulty focusing. All adults are having these same problems now too, with so many things going on at the same time. And basically what it is we hook you up to an EEG, which measures your brain waves. It measures the output coming from your brain. And we know I'm going to do the air quotes now, we know what normal is. And there's a range of normal, of course, for when, you're at a certain point in the day and a certain level of consciousness. And we know what abnormal is. And so what happens is we take that EEG readout and we feed that into a computer program, and then that's fed into a TV screen. And so when you have a normal output, the TV screen it's showing a movie that you pick, and the screen is wide and clear. So this is your reward. You get to watch a movie. When it's not in the normal range, then the screen will either shrink or go blurry depending on what is where the output is. And it teaches your brain how to get that reward, how to keep the screen wide and clear. So by doing this brain training and keeping your brain in the normal output, for the patient, they just feel like they get to watch a movie. It's got to be one of the most pleasurable treatments you can possibly have for about 30 minutes at a time. And it is a very long-lasting thing. We do somewhere between 10 and 20 treatments, depending on what the problem is. And it works for a variety of different things. The interesting way that one of the psychologists explained it to me is it's like if you had one very large closet for your entire house. But one closet. So your linens and your sporting goods and your winter clothes and everything that had to be stored was all in this one closet. But you had no shelves and you had no way of organizing it. So it's just this giant mess in the closet. And then now you call a closet organizer, and they come and they put everything together for you. They say, what are your needs? And they put the shelves in, and they put the clothes in, and they put the drawers in, and everything's organized. This is kind of what neurofeedback is. It organizes the brain so everything is working properly and working at the right time, and you can grab what you need, and you can focus when you need to focus, and you can sleep when you need to sleep. And it's an amazing service. I do it myself. I always suffered from not being able to sleep, and it's amazing. Saved me.
Well, now I see why athletes even do it then also.
Yes. Peak performance is a big, big one for this service.
I love what you guys are doing there, how you offer so many different services for so many different types of people. One question real quick about the telemedicine. Would somebody in a different state be able to work with you or your doctor?
Yes. And this is the interesting thing. So let's say that you had to travel and you don't have access to your doctor. It's, you don't know who to go to. You don't know where is a good place to go. You can actually call in, and we can set this up for you when you're traveling as well. And our doctor is actually working on something that you can have a travel kit that goes with you. So you can actually have something like a watch that you would wear that would be able to check your heart rate and your blood pressure and things like that when you're traveling abroad, for instance, and you're not even sure of the type of medical care that you might be able to receive.
Right. I think that's great that you offer that and all the different services. Now, I know you've worked with thousands of different patients and you've helped out a lot of people. Could you choose just one success story to share with somebody that, might help somebody else take the next step to getting healthy or changing their life?
Sure. A recent success story, I can think of a woman who was a very sort of on-the-go, high-powered, type A personality woman that came in for low back pain. She said she had had low back pain for a number of years, but recently it becoming worse and worse and really starting to interfere with her activities of daily living. She wasn't able to work out the way she wanted to work out, and sitting at her desk for long hours was starting to become very painful. So that's what brought her in. But when we do the initial intake with everybody, we are a holistic center, which means we look at the whole body. So although we want to treat you for the reason that you came in, for sure, but we also want to make sure that we look at the health in all of the arenas of you. If we leave something not healthy, but we just take care of the low back, then you still don't have true health. So our intake is very complete. And when she was filling out the intake, she also filled out that she had anxiety, she had a PTSD, she was in the military, and this was causing her to have some depressive type symptoms, as well as she was having some hormonal issues as she was coming up on menopause. And so when we put all of this together for her, we put her in with a psychologist. And the psychologist also did the neurofeedback with her, and this was for her PTSD and the anxiety, depression that was going on, as well as we put her in with the acupuncturist for her hormonal imbalance, and she saw me for chiropractic with her low back. And recently she says she can't believe the difference in how she's feeling. She can't believe the difference in her life and what a change it's made. She didn't know that it was possible to do all of this together, but the reason that I chose this as a success is that I think that it's really important to understand that if you do take one thing at a time, how long it takes to get well. And I think it's so discouraging for somebody because you feel like you're never going to get there. And it's so much harder to do one thing, and not just because, it's a linear time sequence, but when you put them together, your health, it almost blossoms. If you can imagine having all of a sudden your anxiety go down and your low back pain go down at the same time, I mean, what kind of difference does that make in your life? It's huge. As opposed to your low back pain goes down, but you still have so much anxiety that you feel like you're still kind of frozen in your life. So the difference is not just additive, but it's more of an exponential difference. And that's what she described to me. And that's just such a great feeling to be able to deliver that to patients.
Well, that's awesome. And I think it also goes to say for somebody that's feeling any of those symptoms or just in pain or having any mental issues, that they should find a spot that offers not just one treatment, but multiple treatments to help them with their overall health and not just go see one person for one thing at a time.
Yeah. I think it's kind of where we're at these days. I think we all need a team. I started SHIN after working at a place called Kentucky in a children's center. And this was an outpatient center for special needs children, very, very unique. It started in 1943 by Dr. Golden. And she brought together a whole team of doctors to work with special needs children because they had so many systems that were affected. So she had many of the same things. You know, she had the medical doctor, the chiropractor, the psychologist, the occupational therapist, the physical therapist, the dentist. She had all of these together. And, you know, in working there for the beginning of my career, I realized how important it was for these children, but I also realized how important it is for all of us. You know, I mean, in our lives these days, no one's taking enough time to take care of themselves. So to be able to bring health to the different systems at once is almost a necessity now. We don't have the time for these long, drawn-out things, for one. And I would love to say, you know, okay, you know, everybody that sits before me, the biggest thing that you have to do is take time for yourself. But it's just not a realistic thing to say anymore.
Right.
People would love to, but they can't, you know. So we need to be able to combat what's going on in their lives with bringing another aspect of health to them and being able to return them to the lives that they need to get back to, not say you have to stop what you're doing. It's just not possible.
Right. And it makes it nice that it's all in that one location also, all the different services, so they don't have to drive from office to office to office for their different things that they need. So
yes.
Tell me, what if I'm in the Miami area or somebody's watching and they're in that area, where can they find you and what radius do you work with?
We are in the Miami Midtown area, a little north of Midtown. 4500 Biscayne Boulevard is our address. And we're very centrally located. We're right next to I-95 as well as the bridge for 195. And I don't know. What was your other question? I'm sorry.
So people, how far do people usually travel to see you? Probably 20 miles, 15 miles?
It depends on the service. So, for instance, our decompression therapy is something that we have people that come from literally all over the world. We've had Denmark, we've had all of the islands, we had Spain, because it's not something that is found everywhere. We're one of the few offices that offers it. It is getting more popular now, especially, you know, 5 years ago. I mean, we were one of the very few that offered it. But still, we have people that are traveling from all over to come for that service. But if we're chiropractic or acupuncture, something that, you know, is easier to find, maybe it's say a 10 to 20 mile radius. We see people from Coral Gables, from Aventura, some come down from Fort Lauderdale, certainly over from the beach, from Brickell area. Those are probably the main areas that we see our patients.
Yeah, and I definitely want to recommend anyone in the Miami area, if you're suffering any health problems, definitely, you know, I recommend SHIN Wellness and Dr. Wendy over there. Now, what's the best place for somebody to get started with you? Say they want to set up a first consultation and take that health assessment.
There are two ways, so they can just call us. Our number is 305-571-9090. And our team, they're highly trained in how to help get you started and kind of how to point you in the right direction. Or they can just go on the website. We have a lot of information on the website, and you can even request an appointment on the website as well.
Okay, great. And we'll make sure to post those links under this video so anybody can easily access the website, reach out to you, and hopefully get started as soon as possible with not just one aspect of health, but hopefully their overall health.
Fantastic.
Thank you so much. Thank you so much for joining me today.
Thank you for having me.